Hello, my name is Tammy Martin Summers, and I've worked in healthcare for 17 years. I currently work in the operating room as a surgical technologist. My talk today will be on how healthcare industry can help reduce the misuse of opioids during and after surgery. Approximately 51 million Americans undergo surgery yearly. 99% of all surgical patients in the United States will receive an opioid during their procedure. 80% of surgical patients will receive a prescription for opioids. This includes oxycodone and hydrocodone. From 1997 to 2007, the average sales of opioid analgesics per person has increased 402%. From 1999 to 2016, 197,000 people have died from overdose related to prescription opioids. In 2015, 40% of the world's supply of thiamine, the main ingredient for oxycodone and hydrocodone, was consumed by the United States. And in 2017, 191 million opioid prescriptions was dispensed to American patients. These numbers are staggering. And the reason why I'm telling you this is because these are my patients, your family, your neighbors. These numbers are what the CDC have and what are reported. The true number we don't know, which is kind of scary. As a healthcare provider, our job is to help people get better, not have them addicted to pain medications. The goal is to manage acute pain after surgery and minimize the risks of opioid use. The perioperative phases of a surgical procedure are key to making sure a patient's needs are met. The perioperative team, nurses, anesthesiologists, and surgeons have an instrumental role in this process. The perioperative phases and interventions. Perioperative, that's before surgery. This is when a history and assessment are done and patient education. Intraoperative is during surgery. This is when we can introduce non-opioid type medications such as Exparel and nerve blocks. Postoperative, after surgery. Surgeons decreasing the amount of opioids they prescribe and encouraging non-opioid medications. The preoperative phase. This is when the assessment and history is done. A day or two before your surgery, you come in. Sometimes they take blood. They take your vitals. This gives us a baseline. This lets us know if you have high blood pressure, if you're on a medication for, say, your blood sugar. But what's also instrumental is knowing your past history of surgeries and how you reacted to anesthesia and the medication you took and how that worked for your pain management. Patient education, not just informing the patient of their risks of the surgery, but also expectations. Patient, you're having surgery, you're going to be in pain and some discomfort. To have a realistic idea of that when you wake up from surgery will help you manage your pain more appropriately. Intraoperatively, during surgery, we can institute non-opioid type medications to help with pain relief. For example, Exparel is a medication. It's a bupivacaine liposome injectable. So what we do is when the surgery is done, we inject Exparel along the incision site. This liposome stays in your body with the marcaine in it. And as it starts to break down, it releases marcaine throughout the incision site, which decreases your pain level, which will also decrease the amount of pain medication you will take post-operatively. Exparel has seen a 78% reduction of overall opioid consumption. Another intervention is a nerve block. This is when the anesthesiologist injects a marcaine above the surgical incision for, say, a lower extremity, and it numbs that bottom of your leg. This gives you pain relief a few hours after surgery. So when you wake up, you're not in excruciating pain from the surgical procedure, asking for an opioid type medication. Postoperatively, doctors prescribing less opioids and encouraging patients after that prescription is done to seek an alternative, a non-opioid alternative such as ibuprofen. Follow-up is very important, either when the hospital calls or when you see your doctor. This gives your healthcare provider an idea of how your pain is being managed. My goal in this presentation was to inform people on the alternatives of opioid use during and after surgery. It's our duty as healthcare providers to help reduce the amount of opioids patients consume during and after surgery to help minimize this epidemic that our nation is seeing today. Thank you so much for your time. Have a great day.